How do people like practitioners like yourself utilize this lens evaluation to help patients out?
Yeah, so I think the key again is really it's like thinking about a puzzle, right? So if you think about the human body as a puzzle that we're trying to put together, you're not just a spine, you're not just a brain, you're not just a thyroid gland, you're not just, a toenail, right? We're all connected. So it's looking at the different pieces and how they integrate. So, when you have a issue, a symptom, a concern, it's figuring out what the pieces were and where they need to be placed in order to get that to function properly, or where we've misplaced those puzzle pieces that now we're not getting, the picture that we anticipated when you look at the box, right? If you put the puzzle pieces in the wrong place, the picture is fuzzy. So I think, that lens of looking at the body as a whole, looking at the person as a whole, and realizing that sometimes also where you have pain or symptom isn't necessarily the place that's causing it, right? And I always love to give this example musculoskeletally. Like if I put a pebble in your shoe and I ask you to walk around on it all day, you might have foot pain, but you also might get a headache because it affects your entire body all the way up, right? And functional medicine, internal medicine is kind of the same way. If we don't provide, let's say, the proper nutrients to the body, we could wind up with a certain disease, or we eat poorly, we could wind up with diabetes, or right, and the list goes on. So it's really about all those pieces and making sure they're in their proper place and they're being nourished appropriately so that we don't feel ill. And I think that's the lens we need to look through, is a very broad lens to look